Hello, my name is Parker Fritsch, and I'm here along with my fellow colleagues to give you some insight on the cardiovascular system. I have two questions to ask you before we move on. First, how do our bodies have enough energy to get through our everyday lives in such a bustling world? The second question is, how do our bodies remain in perfect balance throughout our everyday lives? Balance meaning we have a temp of 98.6 every single minute of the day, or how our heartbeat coincides with our actions. All of this coincides through one term and one answer, that is homeostasis. This here is the cardiovascular system. The cardiovascular system includes capillaries, veins, arteries, and the heart. But that is just the limits of it. It is responsible for some very important processes though. While maintaining homeostasis, it requires the heart to pump blood filled with oxygen-rich red blood cells, hormones excreted from the endocrine system, and nutrients secreted from the digestive system once digestion has been completed. And it is also responsible for removing excess waste from the bloodstream. That way, the person will not have any disorders on behalf of the cardiovascular system.
Another disorder dealing with the cardiovascular system is dextrocardia. Dextrocardia is a rare heart condition which is leading to the heart pointing to the right side of your chest. It is considered a congenital disorder and is when, meaning people are born with this abnormality through genetics. Its cause is unknown but develops during fetal development. It is a mirror image of the heart, and meaning all your ventricles and arteries and structures of the heart are a mirror image. One of the reasons it points to the right is because of defects in lungs or abdomen and chest. When the function is affected by dextrocardia, symptoms like breathing difficulties and blue lips and skin. When lack of oxygen to the heart makes a person tired and prevent the person from growing normally. There's no treatment for dextrocardia because it occurs during fetal development. The only thing doctors could do is monitor the heart. It is less than 1% of the population that gets this disorder.
Hello, I'm Adrian Datilas, and we've all been in traffic before. It really slows us down and can cause problems. The cardiovascular system has a similar problem. This is pulmonary stenosis. Pulmonary stenosis consists of either the pulmonary valve or the pulmonary vessel itself to become more constricted than normal. It is a genetic disorder and therefore cannot be prevented. It is treated through a process called balloon dilation, in which a balloon is placed within the pulmonary vessel and is then expanded to clear plaque and also expand the diameter of the artery. In the case of pulmonary valve stenosis, as you can see here, what happens is they put in usually a cutting balloon, which is similar to a dilation balloon but has blades which either creates an incision or it can be put into the right ventricle that removes overactive muscles that can cause a stenosis. Fortunately, pulmonary stenosis is very rare. However, if aggressive enough, pulmonary artery stenosis can lead to hypertension, which in turn can lead to a higher chance of heart attacks.
Hi, I'm Marcella Torres, and I'm here to provide knowledge on the disorder known as hemophilia, one of the several disorders involving the cardiovascular system. Hemophilia is a genetic disorder passed on from the mother to the offspring. Normally, it's found in young boys, and it's also found in girls, but it's only found often when the father carries the gene but when he gives it to the daughter, they don't inherit it as the young boys do. And then hemophilia comes along with more than just one type, and on the different types that it comes with, it also depends on the severity. Hemophilia develops joint pain and experiences prolonged bleeding, uncontrollable bleeding, vision problems, and easy bruising. It often occurs when pressure of the blood filling the joint cavity causes significant pain and leads to the bruising. However, with hemophilia, there is treatment, but there's no cure to stop the symptoms forever. There's only provided treatment for as long as needed to treat the symptoms and prevent the filling of the blood in the joint cavity.
Imagine if your heart arteries were switched and your lungs were drowning in oxygen, and the gas exchange between the capillaries and the alveoli was occurring insufficiently. My name is Shelley, and the disorder I will be talking about is TGA. TGA, or transposition of the gray arteries, is a congenital defect that transposes the two main arteries of the heart, specifically the aorta and the pulmonary artery. This causes oxygen-rich blood to go back to the lungs and the unoxygenated blood to go throughout the body. Also been known to cause stenosis, which is a blue tint in the skin. What causes TGA, you might ask? Okay, it occurs in the first 8 weeks of fetal development, in which okay, cut that. This causes oxygen-rich blood to go back to the lungs and then unoxygenated blood to go throughout the body. This has also been known to cause cyanosis, a blue tint in the skin. So what causes TGA, you might ask? TGA occurs in the first 8 weeks of fetal development, in which the aorta and the pulmonary artery will connect to the incorrect chamber, causing life-threatening transposition. The only way to treat TGA is atrial septostomy surgery and The only way to treat TGA is atrial septostomy surgery, and how do you say it? The only way to treat TGA is atrial septostomy surgery, which will anatomically correct the heart. Even though the survival rate is high, risk of coronary complications can occur in the future. Every 1 in 3,300 babies are born in the U.S. are affected by this defect.
While the disorders previously talked about are all deadly and extremely important to understand, I am here to tell you the background of the disorder that gave me a less than 20% survival rate at age 2, forced me to undergo over 40 surgeries, and took the life of 15 of my first friends and kids I have ever known. Philadelphia positive ALL, acute lymphoblastic leukemia, is a mutation between the 9th and 22nd alleles, as shown here. The breakoff basically just switches with the 9th and 22nd, causing the piece that should be on the 22nd to be portioned at the bottom of the 9th allele, causing the patient to undergo an immune response. This can occur with fever, chills, loss of appetite, or in some severe cases, nausea. While some physicians will think it's just a normal immune response, they will begin by treating with antibiotics. However, this will be unhelpful because it'll allow the cancer to go unopposed. Once the cancer has been found, physicians can start with the form of a drug called Gleevec. Gleevec basically breaks this mutation off and does not allow the cancer cells to reproduce anymore. After about 6 months of taking this drug, physicians will move into chemotherapy. Chemotherapy generally takes around 3 months to complete in order to kill off all of the necessary cancer cells. Third, the radiation will be extremely extensive with Philadelphia positive ALL. It will be conducted throughout the entire body, virtually killing every cell in the body, including the muscle cells. If the patient survives this, which is a less than 20% survival rate, then they will be given a bone marrow transplant. A bone marrow transplant involves taking the blood from a placenta after birth, filtering out the stem cells, and transplanting them back into the patient through a cord blood. This basically gives the patient a brand spanking new genetically modified code. This deletes the mutation and allows the person to live, hopefully, the rest of their life. Homeostasis requires all of the body systems, of course, but most importantly, homeostasis requires a lot of heart. Thank you.